Canada's medical establishment is doubling down on sex changes for minors. This, again, is another one of these huge stories that is only being covered by a handful of outlets. The most extensive study of this, the most extensive reportage on this, I should say, comes from the National Post, which has actually been doing a really good job covering an issue that most of the other news outlets are either covering only from the perspective of trans activists or ignoring entirely. And so in this episode of The Briefing, I'm going to take a look at what the story is, what it means for provincial laws right across the country, and what potential impact this could have in the Canadian election that we are currently experiencing. So let's start with the story itself. The National Post headline really does sum it up. Canada's pediatricians advised to support affirming gender questioning 6-year-olds. Now, this is a really interesting way of putting it because they're kind of scrambling a term that really gets used by the CBC, the Toronto Star, almost the entire mainstream Canadian media. And I'm old enough to remember, because I've been writing about this debate since it started like 9 or 10 years ago, when we would refer to sex change surgeries. Then we started talking about transition or gender transition. And now the new phrase that gets used is gender affirming care. And it's an incredibly Orwellian term, and it's very deliberately chosen because all the premises of gender ideology are baked into this term. Because you're not transitioning them, you're affirming their already existing gender. And so you'll notice that with so many of these subjects, the language that we're told to use when reporting on this, when discussing this, when delivering commentary on this, even when debating it politically, their premises of the gender activists, of the trans activists, are baked into the language they ask us to use. And as we know from George Orwell's 1984, the number one way that totalitarians try to win a debate is they narrow the language available to you that you are actually able to use in order to kind of herd you through a funnel into the conclusion that they want you to reach. And so the Post points out that newly published advice to Canada's pediatricians, so doctors for kids, continues to charge full steam ahead with the so-called gender-affirming model of care in the face of increasing uncertainty about its safety, and suggests that parents who don't unquestionably affirm their child's expressed gender risk are harming their child, concerned doctors say. So few important things about that. One, even the National Post is using the phrase the gender-affirming model of care. And this, again, it's a contradiction in terms because it's insinuating, the very phrase is insinuating that a trans-identifying boy, so a boy who's identifying as a girl, that to offer him puberty blockers, cross-sex hormones, eventually surgical intervention, that this would be affirming his gender, as opposed to not affirming his gender. And we'll get into the sort of significance of this to Alberta's laws in just a moment. But I want to pull up the paper here that was released. It was released in Pediatrics and Child Health. It was released late last year. It's just being reported on now in the last several weeks. So it's kind of interesting. The National Post has been doing good work on this, but so much stuff comes out that has such a profound impact on the public debates that we're having that people don't even read. And so the title of the paper here was Gender Affirming Practices for the General Pediatrician. Now, back to the National Post article here. So they know that the advice published in this very short paper, I've got it right in front of me here, in the Canadian Paediatric Society's flagship journal, is completely silent on the CAS review. The CAS review, for those of you who don't remember, I've mentioned it on the Bridgehead briefing before. The reason the CAS review is so essential to understand and to mention when we're talking about the issue of transgender ideology is because it was a 4-year-long independent British review commissioned by the National Health Service that landed last spring, and it concluded that the evidence for gender-affirming care for minors is remarkably weak, and that there are so many different unknowns, not only about gender-affirming care, that is, sex changes for kids, but also socially transitioning. Socially transitioning is when a boy presents as a girl, perhaps by growing his hair long or wearing dresses, or a girl presents as a boy, maybe by cutting her hair short. And so that's why it's social transitioning is something, by the way, that's promoted in Canadian public schools. It is actually a Canadian public school policy that if a child identifies as transgender, that they will socially transition him or her by swapping their name out for either a gender-neutral name or the name of the opposite sex, and they will recognize that student as the gender they identify as, which is all part of socially transitioning. And the CAS review actually points out that there may be genuine psychological harms that come from socially transitioning. It's important to pause here for a moment just to mention, I've mentioned this once before, but I really think that any Canadian watching this asking themselves, why haven't I ever heard about this CAS review, right? It's a 4-year bombshell paper that was released by the National Health Service. It actually was so dramatic in the evidence and in its conclusions that the far left Labour Party actually upheld the emergency ban on puberty blockers for minors. And essentially now the British medical establishment treats puberty blockers for minors not as gender affirming, but as experimental medicine. It's forbidden to use them outside essentially clinical trials. And you might ask yourself, so why have I not heard about this? It's a hugely significant thing in another Anglosphere country, in many ways, a country with the closest relationship to Canada. And yet I've heard virtually nothing about this. Well, unless you read the National Post, you will basically not have heard anything about the CAS review. And so some time ago, I actually went onto all of the major Canadian sites, and I just started searching all the key terms. So Hillary CAS, CAS review, CAS report. I did this on CTV. I did this on Global News, City News. There were no stories at all on the CAS review on any of these sites. The CBC, Canada State Broadcaster, had one story published quite some time after the CAS review made international headlines right around the world. And I write for a European magazine as well. This is a big story everywhere, not just in the UK. And the CBC published one story in which they interviewed a handful of doctors who basically said, we don't like the CAS review. We think that the CAS review is weak. And those are the kinds of doctors who just published this paper. And so as far as Canada is concerned, if you live inside this country, there's a very good chance you just never heard that this happened. If you only consume Canadian media sources, you will not have heard about the most significant study commissioned by a state healthcare system to examine the effects of so-called gender-affirming care. You won't have heard about this at all. And so the National Post, to its great credit, actually emphasizes this. And then they emphasize that the Canadian paper advises pediatricians to essentially do the opposite of what the CAS review recommended and what is now policy in the United Kingdom. They advise pediatricians to offer parents of gender-questioning children advice on social transitions and the many benefits of an affirming environment. Again, an affirming environment here would mean that a boy who identifies as a girl is affirmed as a girl. That's what they mean by affirming environment. And to support menstrual suppression using medications such as hormone blockers for gender dysphoric 12-year-olds if appropriate and desired by the patient. Now, in the UK, puberty blockers are essentially seen as only appropriate in clinical trials due to the fact that there's remarkably weak evidence that they do anything. And again, I want to emphasize here, we're talking about drugs and medical interventions that mean that children who are undergoing these surgeries or taking puberty blockers, the changes to their body are so dramatic that they are very often incapable of sexual intimacy and sterilized before they're even old enough to vote, to make a decision about who should lead the country. So that's what we're talking about when we're referring to appropriate or if desired. Now, one of the reasons I like this National Post report is they actually quote a bunch of Canadian experts who were never, ever asked to speak on CTV, the CBC, Global News, City News, etc. And so Calgary pediatrician Dr. Daryl Palmer said that the authors of this paper are essentially advocating for socially transitioning children. And the paper has actually really alarmed a lot of Canadian doctors, as it should, because they've been urging a reappraisal of the so-called gender-affirming model of care for minors and the meteoric rise in kids presenting with gender distress. And so Pam Buffoni, who is the founder of the parent group Canadian Gender Report, says, parents and young people deserve a balanced view of the care options ahead of them as they make these difficult decisions. This short paper is extremely biased, leaves out inconvenient truths, and presents gender-affirming care as the only option. To be fair, the paper's senior authors responded through their spokespeople, get this, at BC Children's Hospital And Toronto's Hospital for Sick Children, Sick Kids, basically said they were unavailable for an interview, but BC Children said that, quote, research conducted over many decades supports the safety and accessibility of gender-affirming care in this province, and claims that the author took the recent review led by Hilary Cass under review. Hilary Cass, by the way, is a distinguished British pediatrician. They obviously didn't take it under review because if you look at this very short paper, they basically ignore all of the findings. They're also ignoring findings in major studies published places recently like the New York Times, in Finland, in Sweden, in Norway. There's so many different medical establishments that are now throwing the brakes on and saying, what are we doing to kids? In the States, of course, this is a big debate. In Canada, basically nothing. And here you've got, the flagship journal of the Canadian Paediatric Society saying full steam ahead, pretending that this debate essentially hasn't been happening at all. And so several pediatricians said that Canadian practice advice presents gender identity in very young children essentially as a fait accompli and presents information on suicide in a misleading way. There's this often debunked talking point that gender transition is necessary because otherwise young people will experience suicidal ideation. And these studies have been debunked over and over again, and in fact countered by newer research indicating that in many cases the opposite is the case. And a recent Finnish study based on the health records of more than 2,000 young people who sought care at a gender service over a 20-year time span, so this is even longer than the Cass review, found that while gender dysphoric youth have higher rates of suicide than peers without gender dysphoria, 0.5% versus 0.3%, the differences were not statistically significant after researchers took a history of psychiatric treatments into account. And their conclusion was gender dysphoria per se does not seem to predict neither all-cause nor suicide mortality in gender-referred adolescents. But yet you have the Canadian transgender activist, again, just trotting out this line, this idea that we need to accept so-called gender-affirming care because if not, we're contributing to suicidal ideation or at least ignoring it. But the survey cited by the Canadian paper instead reports that 35% of youth who described their parents as strongly supportive said they had considered suicide in the past year, compared to 60% of youth whose parents weren't described as strongly supportive. But Palmer says, look, this data is just being used to frighten parents. And he said, at the end of the day, if you tell parents if they're supportive, it reduces suicide attempts from 57% to 4%, that's just putting a ton of pressure on parents with data that are likely to be highly inaccurate. Important point here. Again, this is a pediatrician from Calgary who is saying this. And in fact, this was concurred with by Dr. Ian Mitchell, who is a professor emeritus at the University of Calgary's Cummings School of Medicine. He said, any consent process involves telling people about harms and benefits and what the evidence is. This is an enormous procedure to change someone's whole identity. This is not a little intervention. And no kidding, we're talking about double mastectomies. We're talking about castration. We're talking about the creation of a neovagina. I'm not going to get into the details of how these surgeries look and how they attempt to create new body parts, but suffice it to say, it's pretty hair-raising stuff. But all of that is just almost entirely ignored in lieu of just telling kids, yeah, well, if you get this, it's going to fix your problem, and telling parents, well, your kids are going to be suicidal unless you pursue this route. And so the authors of the advice wrote that trans-identifying children and youth continue to face many barriers to care. And so their primary concern here was that more trans-identifying youth need access to this sort of so-called care rather than a collective body of international research covered even in places like the New York Times increasingly indicate that what we're embarked on here is roughly equivalent to just medical experimentation. And so just a couple of other high points here that I think are really worth looking at, because it gives you an idea of where the Canadian medical establishment is at least in terms of their entrenched position on the transgender issue. Because obviously the National Post here found, thankfully, a lot of medical experts who were willing to speak on the record while living here in this country, which is actually quite rare. And so this paper builds on the Canadian Paediatric Society's 2023 position statement on so-called gender-affirming care, which said some children may recognize a degree of mismatch between their gender identity and assigned sex as early as 2 or 3 years old. And the goal of practice advice is to, quote, better support pediatricians in offering care to youth and their families, especially if they are waiting for a specialist. These things include making their clinic a supportive space, so affirming, offering social supports, parental supports, exploring safe ways for them to express themselves, and mitigating aspects that worsen dysphoria that can be managed by a pediatrician. And the authors of this paper here, they use 2 stories to offer advice. Now consider the ages of the kids we're talking about. The first involves a girl named Ava. Never mind, a boy. Sorry, I just read ahead. So the 2 stories, this stuff gets very confusing. Anyways, the person referred to, his name is Ava, a 6-year-old who was assigned male at birth. Just for any of you who are blessedly unaware of this kind of lingo, assigned male at birth is basically how trans activists say a doctor correctly identifying the male or female genitalia and thus identifying what your biological sex is. They claim that means you were assigned sex at birth, like the doctor just took a random stab at it. Today's a pink day, tomorrow's a blue day. Everybody's getting assigned boy today. So assigned sex at birth is the way they use this, and it's unbelievably deceptive and quite frankly garbage language. And so this person Ava, who now uses she, her pronouns and has worn dresses for the past 2 years. The parents were described as supportive and eager to support their child's mental and physical health. And the paper says, you provide the family with appropriate resources to talk about gender, connect them to a local parent support group, and describe the many benefits that an affirming social environment has on gender diverse children and youth. Gender diverse is another term you didn't used to hear. The second story is talking about Jackson, a 12-year-old who was assigned female at birth, must have been a pink day, but describes identifying as a boy using he, him pronouns and then engaging in stereotypically masculine activities since age 9. It's really bizarre reading some of these stories because it's basically like gender ideology, eating feminism, and then kind of choking on it as it gets swallowed because we were trying to get rid of all kinds of basic stereotypes. Now, engaging in stereotypical masculine activities since the age of 9 means that you might just need sex change surgeries. And the paper mentions Jackson notes chest tissue development and recent monthly vaginal bleeding that are significant distress and gender dysphoria impacting his mental health. By him, the paper actually means her. And so what the paper advises is recognizing that the local wait time to access a specialized gender care clinic is over 6 months. Now, think about how terrifying that is. There's a 6-month waiting list for kids like this to get sex change treatments. You explore options for menstrual suppression, including hormone blockers, and discuss other forms of care to support his mental and social transition, which involves binding and packing. I regret to inform you that I do need to tell you what those mean. Binding, which is now something that's being made available by pediatricians, is essentially when a female gets it's very similar to a tensor bandage in the way that it functions, but they wrap it around their chest in order to flatten their chest so they can present as male. These things are very, very dangerous. I won't describe the side effects that sometimes take place, but it actually causes chest compression in quite a dangerous way, which is why advice varies on how long you should be wearing these things. The second, packing, is literally, these things are available online. But now, as you can see, they're also recommended by pediatricians who support the gender-affirming care model. So a packer would be a female child who is literally given a plastic male member to put in their clothing so that they can appear as if they have a masculine bulge. I'm quoting from the Canada Flagship Journal of Pediatrics here. It's unbelievable the kinds of things we have to cover in 2025. But this is being recommended to Canadian doctors right across the country in the Flagship Journal. So the Canadian authors basically recommend that pediatricians provide advice on social transition, including the things that I just mentioned, as well as changing their name to reduce gender dysphoria. And this kind of thing it's really kind of stunning because keep in mind that we actually finally have in this country at least one province that has followed the sort of moving international consensus on these surgeries, and that's Alberta, where Danielle Smith put out a number of policies that restrict these treatments. And interestingly, in an interview with Adam Zivo of the National Post, she actually refers to transitioning children, as is described in this article here, as a new form of conversion therapy. That essentially by using surgeries and pills and blockers to make their external body look like how they feel inside, even though that can regularly change. This is essentially a form of conversion therapy, which of course the Canadian government banned. And that's interesting to note because the Canadian conversion therapy ban explicitly made an exception for transitioning a girl into a boy or a boy into a girl. So affirming somebody's actual gender, like real affirming care, which is you are a boy, you were born a boy, you have a good body, a healthy body, and here's how we can make you feel comfortable, here's how we can address your gender dysphoria, that's conversion therapy. But helping a boy who thinks he's a girl physically appear female through surgeries and blockers and things like that, that is not conversion therapy. So back to the original language point, the level of gaslighting going on is really extraordinary. And so here's a short clip of Danielle Smith detailing the policies that recently passed in Alberta.
I want to start by saying that every Albertan who identifies as transgender, I care deeply about your happiness and your well-being. I support you in becoming the person that you want to be or who you already are. And as Premier of this province, I will ensure your rights are always protected. For children who identify as transgender, I want you to also know that these policies are being implemented in order to protect the choices you have regarding altering your physical body until after you've grown mature enough to make such choices safely and with a full understanding of what that means for the rest of your life. These policies include a prohibition on gender reassignment surgeries for minors aged 17 and under. For children aged 15 and under, puberty blockers and hormone therapies for the purpose of gender reassignment will also not be permitted, with the exception of those who've already commenced their treatment at this time. For minors aged 16 and 17 who wish to start hormone therapies for gender reassignment purposes, this will be permitted with parental physician and psychologist approval and consent. Alberta's government is also working to attract specialists in gender reassignment surgeries and care to Alberta to assist adults who have a wish to transition, and we plan to build a private registry of these experts to support their lifelong health needs. In our classrooms, we will ensure discussions about gender identity and other sensitive subjects happen at the right time and with the parent-child relationship at its core. This will include a parental opt-in consent requirement when teachers plan to discuss subject matter related to gender identity, sexual orientation, or sexuality for K-12 students. Further, children aged 15 and under will require parental notification and consent before their name or pronouns are changed in school. For minors aged 16 and 17, parental consent won't be required for this, but parents will have to be notified.
So obviously, this flagship journal's release has an impact on what's going on in Alberta right now. And what's particularly interesting about Premier Danielle Smith's decision to pass the legislation that you just saw her describing there is that Danielle Smith is not a social conservative. Danielle Smith is a very pro-LGBT in almost every way. In fact, Danielle Smith left the Wild Rose Party or crossed the floor with a section of the Wild Rose Party back in the day in her previous political life because she actually said social conservatives had too big of an influence in the Wild Rose Party. Yet here is Danielle Smith putting forward legislation basically banning sex change treatments for minors. That is an indication of the extent to which this issue should be nonpartisan and that this issue simply should be one of protecting children from what amounts to medical experimentation, according to medical establishments increasingly around the world. And so the fact that Danielle Smith was willing to take the step also indicates how persuaded she is that this is a necessary step, how much medical backup she had. I quoted several Albertan doctors that spoke to the National Post about this issue. They also spoke to Dr. Edward Less, another Albertan physician who is appalled by these transition treatments. And it also means that Danielle Smith, who is a very savvy political operator, which is why she is where she is very certain of how popular these policies actually are. And what's particularly interesting in the current political context, in the federal election that we're currently in, is that Danielle Smith passed these policies. She went further than anyone expected her to. And then she had a leadership review where she got over 90% approval rating at the largest political convention in Canada. Thousands of people showed up and they roundly rewarded her for all the different things that she's done. The Alberta story is very inconvenient in this federal election, which is why you don't even have people like Prime Minister Mark Carney or Jagmeet Singh. You don't even have them really attacking Alberta over this right now. Why? Because the Alberta example is an example of somebody who isn't a social conservative. She's not a Roman Catholic like the previous Premier Jason Kenney was, or previous Conservative leader Andrew Scheer was. She's not, as far as I know, a Christian at all. And so as such, she's not convenient to target on this. Instead, she's a woman who's very libertarian, but also has been traditionally very pro-LGBT and actually has had falling out on the right with social conservatives because she fundamentally disagrees with them, saying this is something that we need to do. And that after she did this, she ended up at one of the largest political conventions in Canadian history, provincial that is, actually ends up getting a wildly resounding approval rating from the members of her party. Again, thousands of people showed up. They're hoping to make it even bigger next time around. And so the story is really sort of inconvenient because Alberta kind of signals to the entire country that it's possible to look at what the medical establishment is doing around the world and starting to opt out of this kind of stuff. But you still have this totally entrenched kind of Canadian blob, the Laurentian elites is what Stephen Harper liked to refer to them as. But you have the mainstream press, which with the exception here of the National Post, isn't touching this issue with a 10-foot pole and is pretending the Hillary Cass review never happened, that it just didn't happen, and have not reported on what's going on in Finland and anywhere else either. Then you have the Liberal Party, which is all in on gender-affirming care. Justin Trudeau in particular was, as we've discussed in earlier episodes, because Prime Minister Mark Carney has a trans-identifying daughter, at a very minimum, he's not going to touch this issue with a 10-foot pole. Even if he disagrees with her on some aspects of this, he's not going to touch this for the purposes of family peace. So I don't think we can expect any change on policy from Mark Carney, which before we found out what we found out about his family, I wasn't sure what Mark Carney would do because again, it's the Labour Party in the UK that made the emergency ban on puberty blockers permanent. The NDP, of course, has never met a manifestation of the LGBT movement that they didn't immediately get on board with. Jagmeet Singh on the campaign trail has had some interesting choices of people, including an OnlyFans influencer, but then he met with a bunch of guys in rubber puppy masks. So anyways, that's the NDP. We're not going to get any help there. And now, unfortunately, we have the medical establishment sort of reaffirming their support for the gender-affirming model in that Orwellian language, which is really, really disappointing because it means we're going to stay on this train virtually longer than any other country unless we have more politicians like Danielle Smith with the courage to essentially stand up and do the right thing. And she's been rewarded for doing the right thing. And Pierre Poilievre, too, was on a trajectory to starting to talk about this issue a lot more firmly. Yeah, there's only two genders that I'm aware of, turning the questions back around on the reporters, citing a whole list of different policies that he supported. And I think he was trending in the Danielle Smith direction. But obviously, if he is to bring up any of this stuff on the campaign trail now, even if he were to reiterate statements that he made this year or late last year, it is going to be portrayed by the mainstream press as attacking one of Mark Carney's children. That's how it's going to be portrayed. So now he has to stay away from it. And this whole section of policy that badly needs to be debated is not going to be debated because of the way the federal election is unfolding. But we need to do two things here. We need to look at the Canadian medical establishment doubling down on this, and then we need to look at what's going on in Alberta. Alberta is evidence that the rest of the country could be doing the same thing. And there is no excuse for Saskatchewan Premier Scott Moe. There's no excuse for Doug Ford, who doesn't really have any views in general, Doug Ford, on stuff, which should make him a prime candidate to maybe do something like this because it's kind of common sense. But they have no excuse not to do this because unfortunately, Danielle Smith is the only one who is willing to do it. But fortunately, she was very much rewarded for it. So I think the article that we just went through here is going to be one of those pieces of evidence that are brought up in trials when doctors start getting sued by detransitioners, many of whom are already experiencing profound pain and trauma from what they went through as children. I was emailing with one as recently as this week, a Canadian who embarked on transition. And these stories are going to keep on getting louder and louder. We've already read about several of them in the Canadian news just recently. There was an Indigenous person actually who applied for medical aid and dying, applied for assisted suicide because of a botched transition. We're going to be hearing more and more of these stories. And this is really going to look like the last gasp of a movement that's perpetrated an enormous amount of damage on young and impressionable people. Thank you for tuning into this week's episode of the Bridgehead Briefing. Like the video, share it around if you found it helpful. Drop a comment if you want to join the discussion. And you can subscribe to this platform, this podcast, here on YouTube and anywhere else that you get your content. Thanks so much for your time.